participants and attendees. It is a pleasure when I received Martin's invitation and also your invitation, Ross. It was really a good pleasure to me to address, as the president of the European Network of Living Labs, to a community of living labs in Ireland. And that is because back in 2006 and 2008, I had the pleasure to be one more Dubliner and spend some time, 1.5 years or more, in wonderful Trinity College under a postdoctoral research with the graphics, vision, and visualization team. I was aware and hired by the Enterprise Ireland framework, and I had also the pleasure to work in Beaumont Hospital, which is one of the participants in this meeting, with the team of Steve Patchett through colonoscopy quality assessment. So I am happy to get back to, even virtually, to Ireland again. And I also have, of course, the pleasure of getting into the traditional Irish music, which is one of my hobbies, and as a musician, one of my pleasures too. So with this context, after these 2 years, 2.5 years more or less, I came back as a little bit of explanation and description about myself and my background to the Computer Vision Center, where we are developing the artificial intelligence of images and videos, particularly applied in my case to medical imaging, but also in many other cases. We are devoted exclusively to computer vision, and both for research and technology transfer. And one of the elements in technology transfer that we are using is labs, different types of labs as innovation tools. We have research labs, tech transfer labs, and also labs to address the social impact. And we have these living labs. And one of those living labs in which I've been working so far is the Library Living Lab, which is not related to the health area, but has created something that I think that is related also with what you are doing here in Ireland, which is a systemic transformation of the network of public libraries in Barcelona, which are evolving from hubs for books, from places where you have a repository of books, to places in where people can interchange knowledge and areas of innovation, projects related to citizen science, and particularly from the point of view of computer vision and artificial intelligence, we are using now libraries in order to connect with SMEs and the public administration in order to create awareness and to co-create together the new products and services in the area of culture and artificial intelligence. So the element here for the Library Living Lab has been a systemic transformation, which is part of the main goal that we are also talking about today. I had also the pleasure and also the honor to become the president of the European Network of Living Labs, ENOLL. ENOLL is a global network. 20% of our members are living labs from away from Europe. I mean, from Asia, Africa, Australia, South America, North America, most of them are also 80% from Europe, definitely. From 2006, ENOLL was born from a push of the Finnish presidency of the European Commission. It's a non-for-profit international organization, and its aim is to disseminate and to give support to the vision of the living labs that we had the chance to have an introduction now about Martin, and I will try to develop in the minutes to follow. The basic idea of the network, and this is very important because the network is the power of the scalability of the solutions, is the facilitation of knowledge exchange, training, capacity building. We will talk about capacity building later as well, and to foster the project partnerships. Also, very important, influencing policies at national, regional, and also European level. And this is what we are doing, not for all legal members of the ENOLL, but for all living labs. And this is the basic approach of ENOLL. And what I have been doing is just summarize in this one slide, all the points that we have heard before about living labs. What are living labs? Living labs, first of all, they are about innovation. They are about innovation in open innovation ecosystems. And this innovation can be related to new products, new services, or even new ways of doing. methods, new systemic changes, right? So Living Lab is about innovation. But what type of innovation? So it is a citizen-centric innovation, a people-centric innovation, with gathering all the stakeholders in the implementation and engaging a user co-creation approach. When we talk about this multiple helix approach, we talk about the government, the industry, the academia, research centers and universities, and also people, public organizations, civic organizations. We can increase this multiple helix also to the territory and also to the sustainability in terms of environmental sustainability, the green approach. And our basic features that we can have for this particular citizen-centric multiple helix approach is, first of all, that we are doing this in a real life setting. So we are not in a lab within a company or in a lab within the university. It's a real life setting, such as a hospital, such as an operation room, such as a public library, or the town hall, etc. This is very important because this allows that innovation is in touch directly with our users. We have a multi-methodological approach which creates a corpus of methods and tools that we can do in the context of Living Lab for innovation, and definitely the active user involvement in this co-creation process. So this is in one slide how we can summarize the Living Labs. And these Living Labs now are contextualized in the digital transformation. And this is essential because the digital transformation, at least from the perspective that I'm presenting here, is not only an industrial transformation. It is not, as a matter of fact, a new industrial transformation, but it is a huge transformation in itself, because we are now having the potential access to all the human knowledge, potential access to it. We are not implementing or developing it in full, but we have potential access to that. And that brings us not only outcomes and consequences in terms of economic transformations, but also in terms of ethical approaches to how we deal with this knowledge and how we tackle these challenges that, unfortunately, the COVID disease and the SARS-CoV-2 pandemic has shown us cannot be solved by one institution at all. It has to be tackled holistically, congregating a number of stakeholders. And this is a corollary of the digital transformation. Not only an industrial transformation, which has to do with the automation, automatic decision-making, etc., 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 but basically to the fact that we have potential access to all the human knowledge. And we are trying to develop this in ENOLL, in our community of Living Labs, of doers in 5 different verticals during our program of ENOLL action-oriented task forces. Let me give you a glimpse on the 5 verticals, and then we will go in depth into the health and well-being. The first one is social innovation and digital rights, meaning that since we have these hard structures, hard technologies, such as artificial intelligence or blockchain or 5G or others, we are also in need now of some social technologies to allow these innovation processes to happen. So there is a room for social innovation by using Living Lab technologies, because these Living Labs appear now as a tool in order to connect these social transformations led by innovation to the actual hard with. The second one is social of artificial intelligence. This has to do with the different dimensions that we can identify for the impact of artificial intelligence. Labor is one of them, but also education, including also the way in which we perceive awareness, arts, ethics, etc. Of course, we have health and well-being next, but definitely what I would like to bring you here is something that have been highlighted before, is the transition from patient to protagonist. We will try to develop this approach in the view that we are facing it so far. Then we have rural living labs as well. Rural living labs appear as a complementary part of the smart city, but also very related to the sustainability in terms of energy and environment. So there is a green component of the rural areas, not only in agriculture, but also related to tourism, etc., etc., etc. So we have organized ourselves a community community of labs. This is not a think tank. These are labs like you are, in which we are doing things, we're exploring innovation, connecting to our research centers, our academias, etc. And we are developing this led by the leading living labs in Europe in those areas. As I was mentioning before, this is not happening spontaneously. We need to develop some capacities and some methods in order to consolidate the view of multi-stakeholder user-centric innovation. And for that reason, the European network of living labs have developed its capacity building program. And this is very, very important. And I think that is a message that eventually, historically, has not been stressed enough, that we need, as far as we need also skills in order to operate with a device, or in order to understand the results of automatic decision-making system. We also need some skills in order to orchestrate this ecosystem of co-creation. We need to develop the new right job profiles, and we need to give them acknowledge and recognition. And this is exactly what we are trying to do in ENOLL. So as you can see in this introductory picture to ENOLL as a community, what we are trying to do is putting together our members and also to try to help them to share their knowledge from a very pragmatic and practical approach in order to create this innovation-led growth and positive social transformation. Let me address now particularly to the case of health and well-being that we have been we are going to be speaking of during this afternoon now. Yes, here the main idea is, as was mentioned before, is to explore the transition from patient to protagonist. So the future universal health systems will not only be for the treatment of illnesses, but for the development of healthy lives and to support our well-being. But this is the key element for the sustainability of new business models. So the role of patients and their families will be most relevant, since the co-creation of this new universal health system implies the redefinition of the roles and decision of new responsibilities also for the different partners. So the horizon of the silver economy, particularly in Europe, and I'm coming from a country, Spain, in which is this very true, provides the basis for this global transformation. Let me give you a number of examples that we have been developing in the community of ENOLL. The first, I would like to give you these examples of living labs from different international projects. The first is an example of the Laurea Living Labs in Helsinki, Finland, in which we have been developing together with them the Smart Hospital Living Lab. This is an approach in which we are developing, our colleagues of Helsinki have been co-developing together with the region new services in a floor of a hospital as an exploratory area, as a sandbox, in order for new things to happen and new services to be created together with the students of nursery in this case. Test Living Lab in Greece has been using, in a different context, gamification in order to associate the results of the research that they're having in the university together with the hospitals and together with the civil society of Thessaloniki. And gamification allows for awareness of the new services developed in the living labs, and also as a way for the people to understand better what are the value proposition that these hospitals are creating. A third example, very different, and also aligned you are doing, as far as I understand, is the EIT Health Living Labs, the European Institute for Technology. In this case, the approach is associated to accelerators of companies, of startups, very closely related to the hospitals, in the hospitals themselves, in the operation rooms, for new products and services, in order to scale up. As a matter of fact, they have a tool called the Catapult, which allows these startups to develop their new products and services in the actual real-life setting of an operation room, for instance. examples. Let me go for the case of Spain in order to give you a reference for a national for national approach. I selected 4 different examples. The first one is Healthcare Living Lab in Catalonia, Barcelona. You will have the access to the slides and the links, so you can have more information about that if you want. So Healthcare Living Lab is in the area, is in the scope of this EIT Health, creating accelerators for startups, from Catalan startups and SMEs that can use the public health system in Spain, and particularly in the area of Catalonia, in order to propose new solutions and to test them and accelerate them in the actual environment. The next one, Adacen Living Lab in Pamplona, Navarra, is an example of the association of patients that have been empowering themselves and families in order, particularly in this case with people with brain strokes, in order to, with low mobility and difficulties of integration, in order to change not only their treatments, but also their mobility in the cities, and also the way in which they are interacting and co-deciding, co-creating their journey, their path for the rehabilitation, etc., etc. This is changing not only the health system, but also the way in which these people and families are living their life. And an example of the civic society integration into the living labs. Irusicaixa Living Lab in Barcelona is a public led living lab in which they are working in the north in Barcelona, in Mataró, and now with other projects as well, for the development of new ways of interacting for the public service, together with people which are in the area of AIDS, which have the illness of AIDS, so they can support them not also in the treatment, but related also to strong components and concerns related to the integration, the social integration, and how they can find jobs and how can they develop their labs. So this is new things that we need to understand how we can do when we are treating not only the virus, also the consequences of you having this virus. Last but not least, I am proud that I am, as a Galician man myself and a member of another Celtic community, our Lab Saúde in Galicia has very recently opened its own network of health living labs. Particularly the first living lab is in Ourense, and they are using a very interesting tool, which is public innovation procurement, which allows for companies to invest together with their national health system in the development of new tools and services in an agreement with risk. So they are co-creating. They are part of the risk of the developing that this tool. And Galicia has done a great job in having 50% of all the budget that Spain had for innovation procurement, for public innovation procurement, and in order to create this network of living labs. Very interesting approach.
Sorry, Fernando, we are out of time. If you want to maybe just finish off the last few slides, if you could. Thank you.
Yes, definitely. I have just my last slide, so that's it. Finally, we had the two different projects, the Helium project and the HOCOR project, which are in the international context, two Interreg projects that show how ENOLL can contribute also in the harmonization of these processes of living labs. You will have soon news very soon about the results of some of these projects and new projects. And since I am finishing my presentation now, I just wanted to give you the link to ENOLL, enoll.org, where you can have more reports and information. And definitely, I welcome you to contact us and to integrate our community of living labs. The summary, very quickly: our challenges cannot be tackled by one organization alone. Living labs are tools that provide a people-centric approach to innovation. New business and sustainability models and harmonization of methods and tools are essential in this new context to get the journey from patient to protagonist. And for that reason, we have created our action-oriented task force on health and well-being. And you are welcome as enthusiastic innovators to join us. So I'm finishing with that. Guru of Madahat, thank you very much to all.